So, as the lockdown is beginning to ease, what have we learnt so far from all these high deaths and what should we be doing differently? So, if you stay tuned for this episode of Doctor's Orders, I will be going through some of that today. So, keep watching Doctor's Orders. Hello and welcome to another edition of Doctor's Orders. I'm sorry I've not been posting for a few weeks. Firstly, this was due to me being extremely busy on social media after I appeared on Beat the Chasers on 1st of May. Don't forget it's still available on the ITV Hub for a few more days, so don't forget to watch it before it disappears. I was also quite busy at the end of Ramadan and I wanted to wish everybody Eid Mubarak. It did feel a bit strange celebrating VE Day or Virtual Eid Day while trying to adhere to the social distancing rules. I hope everybody had a great day and you were able to communicate with each other via Zoom and telephone. I thought this is a great example of how you can meet somebody using your stick to maintain your 2 meters distance. Absolutely great idea, guys. So it looks like some aspects of the lockdown are being eased, and this probably was necessary because flatlining the economy would have not been very good for the health effects of the population anyway. So the worst is over, the death rate is reducing in the UK, but it's important that we go over the lessons that we've learned so we don't repeat the same mistakes. I know 6 people personally who've died because of the coronavirus, so please do not underestimate it. Please do follow the government advice. But what about the government advice? It is a shame it can be a bit vague and woolly at times. Nobody really knows what stay alert means, and people are beginning to flout the rules, and even amongst the government themselves, which then undermines any advice they're going to tell us. And it seems that if you come up with the right excuse, you can justify just about anything, such as visiting Barnard Castle in Durham just to get an eyesight test. Well, it looks like Neil Ferguson should have probably just come up with a better excuse, such as I was testing out some Viagra. So if we do look at the mortality figures, we see that the UK actually has the worst death rate per million. So it looks like we're finally good at something. Well, that's killing people. But what is also surprising is that the second highest mortality figures are in Sweden. Now, we all know that they decided not to do a lockdown and, just like the UK, thought it'd be better to follow a path of herd immunity. But maybe now they are regretting it. Look at its immediate neighbour, Norway. That has a very low mortality, whereas they did implement the lockdown and also did a lot of testing. So allowing the virus to run rampant may not be the best policy. There's been a lot of debate about masks, and the government has finally agreed that wearing masks, at least on public transport, is a good idea. And I would agree with this. We know that if you and somebody that you are interacting with are both wearing masks, no matter what type it is, it will at least reduce your exposure. And it has been shown that the higher the exposure you have to the virus, the more likely you are going to be severely affected. And that's why a lot of healthcare professionals have succumbed to the disease. Now, they are advising you don't necessarily have to wear gloves. And again, this is reasonable. If you wear gloves all day, you're going to just transfer everything onto the gloves and you're much less likely to wash your hands, which is the best way of preventing the virus. This video here is an example of somebody wearing a mask or not wearing a mask on a tube, doing nothing but just talking to somebody. And you can see there is a big difference when they do or do not wear a mask. So it probably is a good idea to wear one, I would say. What about the BME population? We certainly did find that certain groups were a much higher rate of death from this coronavirus. And first of all, this included diabetics, who accounted for 25% of hospital deaths and admissions, and we also saw a very high rate of deaths in the BME population, even in the healthcare professionals. So there were calls from various organizations that all frontline workers should have an individual risk assessment to determine where they should be deployed and what sort of protective equipment they should be given. And I'm pleased to announce that a lot of employers now are doing this, and please do use the appropriate forms for this. Another new update on the official coronavirus symptom checker. It has now included loss of taste and smell as part of the symptoms of coronavirus. Again, a few weeks ago, I did talk about this being an important symptom of it. So it's great that it's now included. So if you develop a lack of taste and smell, you probably should isolate. But if you look more carefully at your own symptoms, you probably will find you will have some others as well, such as fatigue or headache, rather than just cough and temperature. So please do stay alert for those symptoms as well. About schools reopening. Well, I don't really agree with the government that they should be opening at the very beginning of July. I think that's a bit too early. Now, transmission rates are still going to be high and may increase further with school children. And don't forget, we have even seen that children can be affected by this. And we've seen cases of Kawasaki's disease, which I did talk about in one of my previous posts. Now, the BMA has also released a statement saying that they also think that schools should not open yet. We don't quite have enough evidence either way regarding their safety. So please watch this space. Allowing the virus to run rampant in an institution is never a great thing. And we did see in the care home debacle that they didn't handle things very well. The staff were not given the right protective equipment. And as a result, 1/10 of the care home population died. And actually, the government was not telling us the true figures of care homes and not including them in their mortality rates. So we really do not want a repeat of this situation as well. And it's important that we don't fully reopen everything until we have a good system of contact tracing, which also means a lot more testing, which is still very slow, although we are beginning to see some aspects of that. And another thing we did discover is that there were certain groups whose oxygen levels went extremely low, and they didn't really show this until it became too late. And we call them happy hypoxics. And it also helped us understand how exactly this disease affected the lungs and the circulation inside the lungs. So it's important that those people who've got some underlying lung disease should probably get their oxygen levels checked. If you cannot buy one yourself, then we do now have some organizations delivering pulse oximeters via taxi and bike. And this will then measure your oxygen levels as well as your pulse, and then can help the doctor to assess your situation and give the appropriate advice. So if you've got any lung existing conditions, please do speak to a doctor about getting a pulse oximeter to monitor your oxygen levels, and then they can advise you appropriately. So that is the end of my doctor's orders today. Please do not forget to share, like and subscribe this video, and watch out for future updates from me. In the meantime, keep watching Doctor's Orders.